Welcome back to another deep dive from Book Podcaster.
Great to be back.
Hey, let's just acknowledge something right off the bat. If you're juggling textbooks the size of small dogs,
Yep.
running on caffeine fumes during clinicals, and maybe occasionally wondering if sleep is just a myth, well, dealing with big emotions can feel like, adding another brick to an already heavy backpack.
Oh, definitely. Been there. It's a lot to handle.
Absolutely swimming in that same chaotic ocean myself back in the day.
Couldn't agree more. And that's precisely why we're zoning in on a really crucial area today. Chapter 15 from Psychiatric Mental Health Nursing by Townsend and Morgan.
The anger chapter.
Exactly. It's all about understanding and navigating the, let's say, sometimes stormy seas of anger.
Right.
Think of this as equipping yourself with a few extra tools for your emotional toolkit. So you feel a bit more grounded when this powerful feeling surfaces both in the folks you'll be caring for. And let's be honest, maybe even in those moments when the hospital coffee machine breaks down.
Oh, tell me about it. Exactly. So our mission for this deep dive is to really unpack what anger is fundamentally.
Yeah, get clear on the basics.
And how it's different from when things escalate into aggression, because those are definitely not the same beast.
A really important distinction.
We also want to peek under the hood. Look at what's happening in the brain when anger flares up.
The neurobiology bit.
Yep, and understand how anger can show up in different mental health landscapes. Super important for you future nurses.
Absolutely critical.
And finally, arm you with some practical, real-world strategies for managing it all effectively. We're aiming for clarity, a dose of you're not alone in this, and hopefully a few of those satisfying aha moments along the way.
Sounds like a plan. So let's lay the groundwork. Really understanding anger itself.
Okay.
Townsend and Morgan highlight that anger is, well, it's a fundamental human emotion. It's perfectly normal.
Right. Not inherently bad.
Not at all. It's a natural response, often triggered when we perceive that our needs aren't being met, maybe when we sense injustice brewing, or just when we feel that slippery sensation of losing control over a situation.
Right. It's that internal hang on a minute feeling when something doesn't sit right.
Exactly.
Like you've meticulously planned your study schedule, and then bam, the professor drops a surprise assignment.
Instant internal grumbling, right?
Totally. But as the book points out, this normal feeling becomes a challenge when it's expressed in ways that cause harm.
Destructively.
Either outwards, or if you try to just stuff it down and pretend it's not there, excessive suppression.
Precisely. And here's where it gets really interesting. Townsend and Morgan present anger as what's often called a secondary emotion.
Secondary. What does that mean exactly?
Think of it like this. If anger is the smoke you see, there's usually a fire of more vulnerable feelings smoldering underneath.
Ah, okay. Like an iceberg.
Kind of. These underneath feelings could be things like fear, maybe a deep sense of shame or inadequacy, or simply feeling hurt and exposed.
That's such a key insight. It really reframes the whole picture, doesn't it?
It does.
It's like when someone snaps at a colleague for a tiny mistake. But maybe underneath that outburst is a fear of not being competent.
Or feeling overwhelmed.
Or, yeah, feeling overwhelmed with their own workload.
Exactly. And the textbook illustrates this beautifully with the example of Jordan, the combat veteran.
Oh, right. I remember that case.
Initially, his anger just showed up as irritability, lashing out in group therapy sessions. Pretty classic surface stuff. But as they explored further, it became clear that his anger was actually a way of coping with profound underlying grief and that heavy burden of survivor's guilt from his wartime experiences.
Wow.
Recognizing that anger as a mask, for these deeper wounds, it completely shifted the therapeutic approach.
That really underscores that what we see on the surface isn't always the full story. Not by a long shot.
Definitely not.
Okay, so anger is this complex emotion, often with hidden layers. Now, let's talk about when things move into the realm of aggression. How do we draw that line?
That distinction is absolutely vital. Townsend and Morgan are really clear on this. While anger is the internal emotional experience.
The feeling inside.
Right. Aggression is the outward behavior. It's action-oriented. And crucially, it carries an intent to cause harm or exert dominance over another person.
Intent is key there.
Absolutely. Anger can be felt intensely without leading to aggressive behavior. And it can even be expressed constructively. Aggression, on the other hand, is about acting out those feelings in a way that infringes on or harms others.
Okay, so feeling that surge of frustration when your computer crashes right before a deadline is anger.
Yep, totally normal anger.
Actually throwing the computer across the room, that's crossing the line into aggression.
Precisely. That's the behavioral act with potential harm. And Townsend and Morgan helpfully categorize different types of aggression.
Okay, what are they?
Well, there's verbal aggression, which includes things like yelling, name-calling, insults. Pretty straightforward. Then there's physical aggression, which is more overt, like hitting, pushing, or damaging property.
Right.
But it's also important to recognize passive aggression. This can be more subtle, but still damaging over time.
Like the silent treatment.
Exactly, or stonewalling. Sarcasm used to belittle, deliberately undermining someone's efforts. Sneakier, but still aggressive in its intent.
Gotcha.
And finally, there's displaced aggression. That's where someone directs their anger towards a person or object that isn't the original source of their frustration.
Yes, the classic slamming the cabinet doors after a frustrating phone call with customer service.
Yeah. Perfect example. We've all seen that, or maybe done it.
Makes total sense. The book also touches on how aggression can be a learned behavior. That's a really important point to consider, isn't it?
It is. If we connect this to a broader understanding of human development, we see that individuals often learn how to express and manage emotions by, well, watching those around them.
Modeling.
Exactly. If aggressive behavior is modeled in a family setting, maybe in media or within peer groups, it can become normalized. It can even be reinforced. Like if a child learns that throwing a tantrum gets them what they want.
Right, gets results, even if they're negative results.
And they provide a really insightful example with Malik, the 14-year-old who is displaying aggressive behavior at school.
Yeah, particularly when asked to read aloud.
Right. And it turned out that this aggression was a way to deflect attention from his undiagnosed dyslexia.
Okay. So it was defense mechanism.
Totally. His acting out was a defense mechanism to avoid the feelings of shame and inadequacy he experienced when struggling with reading in front of others.
Wow. What's so telling about Malik's situation is how an underlying vulnerability, the difficulty with reading, manifested as outward aggression.
Exactly. It really underscores how behavior, especially in younger people, or those struggling to articulate their feelings, can be a form of communication.
It's not just random acting out.
No, the aggression wasn't random. It served a purpose for him, albeit a maladaptive one, trying to protect himself from that shame.
Okay, so we're getting a clearer picture of the emotional roots of anger and the behavioral manifestation of aggression. Now, let's delve into the fascinating world of the brain. What's happening on a neurological level, the neurobiology of it all.
Right. This is where we see the interplay between different parts of the brain. Townsend and Morgan highlight the crucial roles of the amygdala.
The emotional hub.
Pretty much, yeah. And the prefrontal cortex. The amygdala is often described as the brain's sort of threat detector. It plays a key role in quickly processing threats and triggering our body's fight-or-flight response.
The initial alarm system.
Think of it like that, yeah. It goes off when we perceive danger or frustration, that immediate gut reaction.
So it's the part of the brain that hits the panic button, so to speak.
In a way, yes. It's responsible for that immediate emotional reaction. Now, on the other hand, we have the prefrontal cortex, which is located right in the front part of the brain.
The thinking part.
The higher level functions part. Things like impulse control, reasoning, planning, decision-making. It's essentially the brain's control center, helping us to regulate those initial emotional impulses from the amygdala.
So if the amygdala is the gas pedal,
Yeah.
the prefrontal cortex is the brake system.
That's a really helpful analogy. The prefrontal cortex helps us assess the situation, consider the consequences of our actions, and, crucially, inhibit impulsive reactions. Put the brakes on.
But what happens when those brakes aren't functioning optimally? When there's impairment?
Well, that's where things can become more challenging. The book explains that in certain conditions, like post-traumatic stress disorder, PTSD, or maybe following a traumatic brain injury, the brain's ability to regulate these emotional responses can be impaired. The connection isn't as strong, or the prefrontal cortex isn't working as effectively.
So lowers the threshold.
Exactly. It can lower the threshold for aggressive reactions, meaning it takes less to trigger that fight or flight response, and it becomes much more difficult to engage those inhibitory controls, those brakes.
And Townsend and Morgan also make a connection between this and certain psychiatric disorders like schizophrenia and bipolar disorder during manic episodes, right?
Yes, they do. They note that poor impulse control, which is a characteristic feature in some phases of these conditions, can be linked to neurological differences that affect anger regulation.
So there's a biological component.
There can be, yes. It's important to remember that it's always a complex interplay of factors, biological, psychological, social. It's not solely neurological.
Right, nature and nurture.
But these biological underpinnings can certainly contribute to difficulties in managing anger and impulses in some individuals.
This is all so interconnected. It really emphasizes that anger isn't just a simple feeling. There's so much going on.
Definitely.
So how does this actually manifest in the context of different mental health conditions that, you might encounter in your nursing practice?
This is a crucial area for mental health nurses to understand. Absolutely. Townsend and Morgan provide some specific examples. Let's take individuals experiencing schizophrenia. Sometimes paranoid delusions, which are these fixed, false beliefs that can feel incredibly real to the person.
Like someone's out to get them.
Exactly, that kind of thing. These delusions can lead to a heightened sense of threat. This feeling of being persecuted or in danger can understandably trigger hostile and potentially aggressive responses. It's like self-protection in their perceived reality.
That makes perfect sense. If you truly believe someone is trying to harm you, a strong reaction is almost inevitable. What about borderline personality disorder? We often hear about intense emotional experiences there.
Exactly. A core characteristic of borderline personality disorder, or BPD, is significant instability. Instability in emotions, interpersonal relationships, self-image, and behavior.
Right, lots of ups and downs.
Very much so.
Yeah.
This can include experiencing very intense and rapidly shifting emotions, including these overwhelming surges of anger. These intense feelings can sometimes lead to impulsive behaviors and angry outbursts.
And what about substance use disorders? It's a common perception, maybe a stereotype sometimes, that intoxication can lead to increased aggression.
It's often grounded in reality, unfortunately. Many substances can impair cognitive functions, including judgment and impulse control.
Lowers inhibitions.
Precisely. This lowering of inhibitions can make it more difficult for individuals to regulate their emotions. It increases the likelihood of anger escalating into aggressive behavior, maybe in response to triggers that they might otherwise manage more effectively when sober.
And even in conditions we might not immediately associate with anger, like dementia. That was a surprising example in the book for me.
It's a really important one because it highlights that aggressive behaviors in dementia are often driven by different underlying factors than, say, the anger we just discussed in BPD.
Okay, how so?
Think about someone like Mrs. B in the case example from the book. Her aggression during bath time wasn't necessarily rooted in feeling angry in the typical sense.
Right, she had Alzheimer's.
Yes. Instead, her behavior likely stemmed from feelings of disorientation, fear, and a loss of control as she was being assisted by an unfamiliar caregiver in a way that felt intrusive or frightening to her.
So the confusion and fear triggered it.
Exactly. Her confusion and unmet need for safety and comfort were what triggered her agitated and aggressive response. The crucial learning point here is that understanding the specific trigger in the context of their cognitive impairment is key to effective intervention.
So figuring out the why behind the behavior.
Always. In Mrs. B's case, using familiar routines and providing gentle verbal reassurance made a significant positive difference. It addressed the underlying fear and confusion.
That's such a powerful reminder to always try to understand the why, especially when working with vulnerable individuals. It's not always just anger.
Absolutely critical.
Now, Townsend and Morgan also outline what they call the anger cycle. Can you walk us through that model?
Sure. The anger cycle is a helpful model for understanding the typical progression of an angry episode. It helps visualize how things can build up.
Okay.
Townsend and Morgan describe it as generally having 5 phases. It usually begins with a triggering event, could be an internal thought, an external situation, a perceived slight something initiates the anger response.
The spark.
The spark, yeah. This then moves into an escalation phase where the intensity of the anger begins to build. You see signs of agitation increasing.
Things are heating up.
Right. If the anger continues to escalate without intervention or effective coping, it can reach the crisis phase. This represents the peak of the emotional intensity, maybe where aggressive behavior is most likely or occurs.
The explosion point.
Kind of, yeah. The peak. Following this peak, there's usually a recovery phase where the individual begins to regain control, the intensity of the emotion starts to subside, they start calming down.
Okay.
And finally, there's often a post-crisis depression phase. This isn't always major depression, but the person might experience feelings of guilt, shame, remorse, maybe embarrassment or sadness, related to their actions during the crisis.
The aftermath.
The emotional aftermath, exactly.
So it's not just a sudden explosion. There's usually a buildup and then a cooling down period afterward.
Exactly. And understanding this cyclical nature is incredibly valuable for nurses.
Why is that?
Because it provides opportunities for intervention, particularly during that escalation phase.
Before it hits the crisis point.
Precisely. Recognizing the early warning signs, maybe clenched fists, raised voice, pacing that someone is moving from feeling upset to becoming increasingly agitated allows for proactive strategies. You try and de-escalate the situation before it reaches a full-blown crisis.
Catch it early. Makes sense.
It's all about early recognition and intervention when possible.
Okay, so we have a solid foundation now. Understanding anger, aggression, the brain's role, how it shows up differently, the cycle. Now let's get down to the really practical stuff. What concrete steps can nurses take when encountering someone experiencing anger, maybe potential aggression?
Right, the interventions. During that escalation phase, when you start to see those early signs increasing agitation, maybe louder voice, tense posture, Townsend and Morgan emphasize several key interventions.
Okay, what's first?
First and foremost, maintaining clear and calm communication is paramount. Your own demeanor is huge.
Your presence matters.
Absolutely. It can significantly influence the direction of the interaction. A calm, steady, reassuring presence can help de-escalate. A tense or confrontational approach, that can unfortunately just fuel the fire.
Stay calm yourself. Easier said than done sometimes, but crucial.
Incredibly crucial. Offering the person time and space to cool down can also be really effective. Sometimes just allowing someone to step away from the immediate situation, maybe go to their room or a quiet area, can help them regain composure.
Like giving them a moment to reset, catch their breath.
Exactly. And setting firm but respectful limits is also vital. You need to clearly communicate what behaviors are not acceptable while still acknowledging their underlying feelings.
How do you do that?
Well, for example, as the book suggests, you might say something like, I can see that you're feeling really upset right now, and it's okay to feel angry. However, it is not okay to yell at me or threaten others.
Acknowledge, then set the boundary.
Right. Then maybe offer an alternative. You can take a walk down the hall with me, or perhaps we can sit here quietly for a few minutes until you feel calmer. It validates their emotion while clearly stating behavioral boundaries and offering constructive options.
Okay, that makes sense. What about when a situation has already reached that crisis point? Aggression is imminent or already happening?
In a crisis situation, the absolute priority is safety. Full stop.
To suit you first.
Always. Safety of the patient, yourself, other staff members, and any other patients in the vicinity. This often involves calling for immediate assistance. Don't try to be a hero alone.
Right. Call for backup.
Activate any established emergency codes or protocols within your facility. Team approach. While maintaining a calm demeanor is possible, continue to use de-escalation techniques if it seems safe and appropriate.
But sometimes it's beyond that.
Sometimes, yes. If the individual poses an immediate and significant threat to themselves or others, unfortunately, more restrictive measures like seclusion or physical restraints might need to be considered.
The last resort.
Absolutely, the last resort. Always adhering strictly to ethical and legal guidelines, facility policies, and only for the shortest duration necessary to ensure safety.
Okay. And what about the crucial steps after a crisis situation has resolved? The dust has settled.
Yeah, the post-crisis phase is a really important time for debriefing, learning from it.
Debriefing who?
It should involve both the patient, once they are calmer and more receptive, of course, and the staff members who are involved. For the patient, it's an opportunity to process what happened, maybe help them identify potential triggers for the episode with your guidance.
Connect the dots.
Exactly. And begin to develop or reinforce coping strategies they can use in the future to manage their anger more effectively. Build those skills.
And for the staff?
For the staff, debriefing provides a chance to review the incident, discuss what went well, what could have been done differently, identify any learning points for the team, and crucially, ensure that everyone feels supported after what can be a very stressful event.
Support for the caregivers, too. Very important.
Essential.
And the book has that really practical clinical tip. It seems so fundamental, but so important for safety during these interactions.
Yes, that reminder to always position yourself strategically, ideally, between the patient and any available exit.
Why is that?
This simple positioning prevents you from being cornered, which is a dangerous spot to be in. It provides a clear pathway for either you or the patient to move away if the situation escalates further or needs de-escalation through creating space.
Maintains an escape route.
For both of you, potentially. And it's also crucial, as the tip implies, to never touch or approach an escalating patient in a way that could be perceived as threatening or cornering them. Maintain personal space.
Got it. These are all incredibly valuable strategies for navigating those immediate, intense situations. But what about the longer-term picture?
Yeah, helping people build skills over time.
Right. What kind of support can help individuals learn to manage their anger more effectively over time? That's where anger management programs come in, right?
Exactly, those structured approaches. Townsend and Morgan outline some common components that are often found in effective anger management programs.
Like what?
Cognitive behavioral therapy, or CBT, is frequently a cornerstone. It helps individuals identify and challenge the negative or distorted thought patterns that often fuel angry reactions.
Changing the thinking behind the anger.
Pretty much. Techniques like anger journaling can be a really valuable tool here for increasing self-awareness, noticing triggers, patterns, intensity of angry responses.
Mm-hmm.
Programs also often incorporate stress reduction techniques, things like deep breathing exercises, progressive muscle relaxation, mindfulness practices.
Calming the body's response.
Right, helping regulate that physiological arousal associated with anger. Then there's often role-playing and assertiveness training.
Practicing different ways to respond.
Exactly. Providing individuals with healthier, more effective ways to express their needs and frustrations without resorting to aggression. Learning to say no appropriately or state needs clearly.
Skills building.
Definitely. And group therapy can be really powerful too. It offers a supportive environment for learning from others' experiences, getting feedback, and developing greater emotional literacy, understanding, and naming emotions.
Learning you're not alone in it.
That's a huge part of group work, yeah.
The book also gives that specific example of an anger thermometer exercise used in a residential program. That sounds like a really practical and visual tool.
It is. It's quite effective. The anger thermometer is basically a way for individuals to identify their own early warning signs of escalating anger.
How does it work?
They assign a number, maybe 0 to 10, or use descriptions like calm, annoyed, furious, to different levels of their emotional and physical arousal.
Like mapping it out.
Exactly. They learn to connect those levels with specific internal cues, like maybe level 3 is feeling my shoulders tense up, level 5 is starting to breathe faster, level 7 is wanting to yell.
Okay. So they recognize the signs earlier.
Precisely. By becoming more attuned to these early indicators, individuals can learn to implement their coping strategies, like deep breathing or taking a time out before their anger reaches an unmanageable crisis level, intervention at a lower level.
Very cool, very practical. Finally, the chapter emphasizes something really critical: cultural considerations when understanding and responding to anger.
Absolutely essential. How anger is expressed, what's considered acceptable expression, and how it's perceived can vary significantly across different cultures.
Can you get any examples?
Sure. In some cultures, openly expressing anger might be strongly discouraged, seen as disruptive or disrespectful. This could potentially lead to more internalized distress or maybe more passive-aggressive expressions.
Right.
In other cultures, however, more direct, maybe even somewhat confrontational expression of anger might be considered a more normative, acceptable way of communicating dissatisfaction or setting boundaries.
So what one culture sees as normal, another might see as aggressive.
Potentially, yes. And that's why, as nurses, it's absolutely vital to be culturally sensitive and to avoid imposing our own cultural norms or interpretations onto others.
Don't assume your way is the only way.
Exactly. We need to be really careful not to misinterpret behaviors that might be culturally appropriate within the patient's context as being inherently aggressive or problematic. What might be considered assertive communication in one cultural context could be perceived very differently in another.
So, ask, learn, be aware.
Understand these nuances. It's crucial for providing culturally competent, respectful, and truly effective care.
This has been such a comprehensive and insightful deep dive into the complexities of understanding and managing anger. Wow.
That's a big topic.
It really highlights that it's not a simple emotion at all. It requires a nuanced, thoughtful approach, both for those we care for and, frankly, for ourselves, too.
Couldn't agree more. And anger, as Townsend and Morgan point out, isn't inherently negative. Remember that secondary emotion idea?
Right, the signal.
It can sometimes serve as a really important signal that something isn't right, that a need isn't being met, that a boundary has been crossed. And as future nurses, you'll be continually developing your skills in understanding those signals, reading those cues, and responding with empathy, with knowledge, and with effective care.
It's a lot to take in, I know, especially when you're already juggling so much, like we said at the start.
It really is.
But remember, you're in the process of learning and growing. You're developing the skills right now to make a real difference in people's lives.
Absolutely.
Take it one step at a time. Be kind to yourselves in the process. Nursing school is tough. And remember that seeking support when you need it, whether it's from faculty, peers, or mentors, is a sign of strength, not weakness.
So true.
You've absolutely got this. And hey, seriously, take a deep breath. You're doing amazing work just by learning this stuff.
Keep going, you'll get there.